Hello, I'm Cindy Miller-Murphy, Executive Director of the Oncology Nursing Certification Corporation. Thank you for taking the time to view this video. During this presentation, we would like to briefly introduce the new certification renewal method from ONCC called the Individual Learning Needs Assessment, or ILNA. This will become the primary way to renew certification beginning in 2016. And it is important to be aware of this method so you can be prepared when your certification is due for renewal. The ILNA method will match your learning needs with completion of an individualized learning plan. The real value in the ILNA method is that it assures you, your employer, and your patients that your knowledge is as strong at the time of your certification renewal as it was the day you passed the test. By identifying your individual gaps in knowledge, ILNA will pinpoint your strengths and weaknesses to help you maintain current comprehensive knowledge of the nursing care represented by your credential. So let's take a closer look at how the ILNA method works.
To begin the process, ONCC will provide you with the login information needed to complete the assessment. This information will be provided early in your certification cycle, before your second or subsequent renewal after passing the test. It's important to take the assessment early, so you'll have plenty of time to earn points to use for renewal. Taking the assessment is convenient. You can complete it at home, at your workplace, or almost anywhere you have a computer and internet connection. There's no fee to take the assessment, and the results are confidential. They'll be seen only by you and ONCC. Here's what you can expect on the assessment. It's based on the subject areas found on the examination blueprint. You'll have about 2 hours to answer 125 items. You'll need to take the assessment in one sitting, but there's no pressure because it's not a test. Think of it as a diagnostic tool. You'll receive your results immediately after completing the assessment, and you'll have the option of printing them. Your assessment results will identify the subject areas where you need to complete professional development activities in order to renew your certification. It will also indicate the number of professional development points you'll need in specific subject areas. If your assessment results indicate that you don't have any identifiable knowledge gaps, you'll be able to choose the subject areas in which to earn points. All renewal candidates, regardless of how they perform on the assessment, will be required to earn at least 25 points. Now here's how your learning plan will enable you to renew your certification. By completing professional development activities in the subject areas identified by your assessment results, you'll earn points you can use for certification renewal. You can earn points using any of 5 activities: continuing nursing education, continuing medical education, academic education, presentations, or publications. You can choose any of these activities, and you are not required to earn points using any specific activity. There are also no limits to the number of points you may earn using a particular activity. To give you an idea of point values, 1 contact hour of continuing education will be equal to 1 point. So let's recap. Early in your certification cycle, you'll complete an online individual learning needs assessment. The assessment results will identify subject areas in which you need professional development. By completing professional development activities in these subject areas, you'll earn points that you can use to renew your certification. You can earn points at any time after taking the assessment until you apply for renewal. Here are some additional items to keep in mind. For your first renewal after passing a test, you won't need to take the learning needs assessment. You'll use your test score report to identify your areas for professional development. Although it's not a test, the information you see on the assessment is confidential and copyrighted by ONCC. It's important that you don't share information about the items on the assessment with anyone, even in casual conversation. Reproducing the items in any way, including talking about them, could put your certification in jeopardy. If you choose not to take the assessment, you can still renew your certification. You may renew by retaking and passing the certification examination, or you'll need to earn 100 points based on the weighting of the current test blueprint. The percentage of points in each content category must exactly match the blueprint weighting. As you can see, by completing the assessment, you may be able to renew your certification by completing fewer but more meaningful professional development activities. The ILNA method can be used for renewal of the following certifications: OCN, CPON, AOCNP, AOCNS, and CBCN. Because no current test blueprint is available for an AOCN or CPON assessment, these credentials may be renewed by earning 100 points, much like the way they've been renewed in the past through the OncPro method. The ILNA Renewal method offers you an efficient way to both strengthen your knowledge and renew your certification. It's convenient, it's easy to use, and it's meaningful. But best of all, it confirms you've maintained the specialized knowledge represented by your credential. To learn more about the ILNA Renewal method, please visit the ONCC website at oncc.org.